Since 1999, half of my business has been sleep apnea appliances. I've been working with an oral surgeon placing these devices. I want you to see the natural attrition that I've gone through with these devices on the market. I eliminated patient problems by giving them what I think is the perfect device. Let's look. There are two different kinds of sleep treatments that you can do, C.P.A.P and the oral device. When the patient reaches REM sleep, the body totally relaxes, the tongue can fall back with the collapse of the upper airway and cause sleep apnea. That means without breath. Let's look at the C.P.A.P machine. The big mask, the machine, you have to have electricity to run it. It's bulky, so when you have to travel, it's very disturbing. Anyway, don't forget that every appliance needs to have a bite. Every mouth wants to eliminate the proprioceptive interference. For oral sleep apnea device, most important, the lower jaw forward, the TMJ has to be relaxed, and it has to be comfortable or the patient won't wear it. Now we'll discuss different kinds of oral devices. Some devices you have to promise to keep your mouth closed. Here's the checklist. Please write them down. It's easy to follow with these different devices to see which they have. Not far enough forward, the patient snores. Too far forward, you can hurt the patient and pull the jaw out. Here's one with the locked-in bite. You have to keep your mouth closed, and this is a tongue depressor. It's very hard on a gagger. Now this is the suction tube type device. It suctions on the tongue, and there's where the tongue was placed. This Sleep Right, it has a little adjustment screw, but you have to keep your mouth closed to keep it in the mouth, and it's one of the cheaper devices on the market. Here's another very crude device. It has some little adjustment there, and then it goes under the lip there. It makes it very painful to wear. Here's another one. It has some metal parts right here. It keeps the mouth forward, and there's the little adjustment metering screw, but no biting surface to bite on. There's another one, kind of soft plastic or sometimes soft hard, and these little straps break quite a bit. No biting surface. Here's another one with straps. It also has hooks out in the side and no biting surface. Very crude on the adjustment. Here's one with plastic. It keeps the mouth forward, but this is a metering screw, but it's a solid bite. There's no biting surface, and okay. And here's one with a metering screw stylist, and it has very limited movement, and there's a biting surface. Here's another device. It has a metering screw, and the hook has limited movement side to side, and there's no biting surface in the posterior. I like the flat plane occlusion idea. Now, if I could get the jaw to move, rotate in a motion, still put it in the forward position. Here's a denture. It has a lot of biting surface problems. So if we take the denture off, we can take a look and see the skin and the wet surface area. Makes it really easy to dislodge. But if we put this plate in place and make a very flat biting surface, it's very easy for the patient to move around, and that's why I devised this flat biting surface idea, to make it so that the patient will have a much easier time chewing or bruxing in the middle of the night. I deliver most of my devices in the mouth by placing the acrylic in the mouth, but it's very aromatic and it takes about 5 minutes. We use these bite planes here, and it focuses it on one point in the front so the TMJ can relax, and we put the acrylic in the posterior area. Here it is in the mouth with the mouth forward, and then we put the acrylic in place, but it's very aromatic and it really creates a lot of smells. Now I just use my bite plate. The plate bite registration focuses the pressure on one point on the front teeth. The bite plate is very thin. It has the holes in there to grab the bite registration material. And like we talked about, the patient has to place their lower jaw in the most forward position. I've never gotten anyone too far forward. So we go forward and back to stretch those muscles and make sure we got it as far forward as we possibly can with what the patient can handle, so it's easy on the TMJ. Now we place the material on the bite plane, and this time I've used alginate because I can mount it in the office. And see, as you can see, it has very nice indentations, and it's easy to mount the appliance, or the two models. There are only 3 types of registration material I want you to use, which is alginate, zinc oxide, and this Memredge 2. This is the finished product. Watch how easy the device moves, and the metering screws in front, the flat plane biting surface. There's the flat plane biting surface right there. And then the metering screws are right in front, so they're easy to get to, and they pull the jaw forward a millimeter or a half a millimeter every time you go one rotation. There's another side of the biting surface, and as you see, inside there's going to be the silicone tubing that lets the device move around very freely. And as you see in this next photo, you'll see how easily it moves side to side, and it can move forward and back also. And there's the inside of the device itself. This is where you can send all your cases, and you'll be very pleased with everything that's being done here in our laboratory. I also devised this orthotic with no interference. The bite plane and the anteriors and the posteriors rotate there. Let's see, you leave the bite plane open like that, and here's the biting surface, and you can put acrylic on the posterior area. I make uppers also.